Ozempic Vagina. This is one of the hot things that people are talking about, writing about, blogging about. What is it? And do you need to worry? I'm Dr. Diane, your Libido Doc, founder of MyLibidoDoc.com. So Ozempic has obviously been the rage for weight loss, for blood sugar balance, all sorts of things. And you can look online and easily find its common and research side effects. But one of the things that people are starting to report are these other types of symptoms that have not been shown in studies. They've not been released as true side effects from the pharmaceutical companies. However, it's also important in new drugs that we pay attention to anecdotal evidence that people are writing about and witnessing, right? That's what I feel like is one of the most important things that I do as a doctor is, one, keep up on research, but two, also notice clinical observations, because not all clinical observations show up in research. So I say that because I'm going to talk about what Ozempic Vagina is, what you should worry about, what you should be aware of. But I want to preface this with saying these are anecdotal things that people are reporting, and these have not been shown from a standpoint of research, of validation, of side effects, all those kind of things, as what has been reported yet from the industry. So what people are reporting, what some people are reporting online as their experience with Ozempic are certain changes. And these changes, while they have not been researched specifically for Ozempic, what's interesting is we see certain changes that happen across the board commonly with rapid weight loss, right? So when we look at rapid weight loss, and then we look at a wide variety of things that could cause rapid weight loss, Ozempic being one of those things, then we can say, we should think for anything that causes rapid weight loss, we should think about these possibilities as things we should watch out for. So one of the things we see with rapid weight loss is changes in our hormone levels. That's very common. One of the most common hormones to change in rapid weight loss is estrogen. Estrogen oftentimes will decline in rapid weight loss. And this is because our fat cells are endocrine organs. They make estrogen. So it's no shock then when we lose our fat cells that since they're not there anymore, they're not producing estrogen, right? And so with this, we can see certain things change. For example, we can see vaginal strength change, the elasticity, the movement, the plumpness, all of the moisture, all of these different things. So we can see this change in hormones and the subsequent vagina and vulvar types of problems. Another thing we see with that, then because of that, can be more laxity. We can see actually changes in the labia. And again, this is what we see with rapid weight loss. Rapid weight loss can come from a lot of different things. So we're talking a little bit general here. Rapid weight loss can cause changes in estrogen and changes to the labia, to the moisture, these sorts of things. Some people are even reporting changes to the looks of their vagina, of their vulva in particular, actually, with the use of anything that is causing this rapid weight loss. Another concern that's coming up right now is potential problems with the microbiome. So we do know that anytime we eat less, oftentimes we see there's a shift in the microbiome, and many of the times this can be positive. But this strong, quick, rapid change in the weight, and with the many gastrointestinal symptoms that can come from certain medications like this, the concern is, could there potentially be a shift in the microbiome? And a shift in the gut microbiome, those good bacteria, is really important because we have problems with the vaginal microbiome, right? The vaginal microbiome actually uses the gut microbiome as a reservoir. So the vaginal microbiome will take and use the bugs, the good bacteria from the gut, to help populate the vagina. And this helps prevent disease. This helps keep the vagina at the right pH, which helps the vagina to feel good. It also can make a difference with sex feeling good. So remember that these are not like hard stats, right? These are not things that have been published from a research perspective. These are just things that we want to be aware of because some people are reporting these things, and just be aware of, hey, there could be something here. It's still more data is really needed to be out to really know. But we just want to make sure that anytime we're doing anything that is causing rapid weight loss. While weight loss can be a really great thing for a lot of people, we want to know, we want to go in with the open, like just like we're doing a surgery, right? We want to know the potential risk. And so we want to go into something and say, okay, well, we see in general with rapid weight loss, we see situations where the hormones change, where we can see change in vaginal lubrication and perhaps changes even in the microbiome. And we just want to be aware of that going in so that we can look out for that and so that we can do things to protect ourselves against that. So, for example, monitoring your estrogen levels. If they fall too low, you might get symptoms that are menopausal type of symptoms. If you're non-menopausal, if you're premenopausal, you want to consider, do you need to do things to balance your hormones? Do you need to get on something like DHEA, right? Do you need to talk to a doctor and get on something like estrogen to support you? Do you need to take a probiotic? We can use certain things like topical stem cell creams or topical DHEA creams right on the vulva in many cases. And this can help to preserve that tissue. We can do things such as vaginal weightlifting. That can help with the strength of the tissue. So there's other things that can be done. But again, knowledge is power, right? We just are going into this and saying, while this is not from a statistical significant research perspective, what has been reported, if people are reporting this, we do want to consider that what are the possibilities of rapid weight loss and changes on the body from this? And how could we actually do our best job if we are choosing to use a medication like this? How could we actually do our best job to protect ourselves against that? So that's what I wanted to say. Again, not hard evidence, not stats here. This is just purely anecdotal things that people are talking about. You can look this up and find a lot of people talking about Ozempic Vagina online. So it's just something to be aware of and to understand the possible mechanisms that could be at hand here. All right, everybody, please do subscribe so I can continue to get you information just like this. I'm Dr. Diane from My Libido Doc. I'll see you soon.